not gonna post me somewhere weird. My patient is C. Jones. I've looked at the patient's chart. I have determined that it is appropriate to insert this Foley catheter. I've taken a look at the labs. I've taken a look at specifically the labs that have to do with the urinary system, so BUN and creatinine. I've also seen her white blood cell count, so I have a good baseline by which to compare whether or not this procedure is doing what it's supposed to do. The first thing, before I even start my Foley catheterization with this group, so this isn't part of the video, is I want to just review how to don and doff sterile gloves. We find that that's one thing that students often don't pass their skills test on, is because they're not donning and doffing their sterile gloves properly. So that's the first thing that I'm going to do. I'm just gonna take just a set of sterile gloves. There is sterile gloves inside my Foley catheter kit, but I just wanna review, first of all, how to don and doff sterile gloves. So take the glove size that's appropriate for you. Before I don my sterile gloves, I'm going to do my hand hygiene. And I'm going to just put on a clean glove. Funky, but that's okay. I want to clean off my surface. So I'm going to be doing a sterile procedure, and that's just another way for me to minimize bacteria getting to places. Okay. Now, my sterile gloves. You'll see when you open up your sterile gloves that it shows you where the cuff should be. Right, so there's the pictures of the hands. That's the same position that your hands should be at. Okay, I also want to have garbage a little bit closer to me. Okay, so with the cuffs, I'm going to put my hands under there and I'm going to open up my packaging. Remember that with a sterile field, you do have an inch border around your sterile field that you can touch. So I'm within that 1 inch sterile border. Opening it up so it doesn't flip back on my gloves. Okay, so this is not sterile. This 1 inch border, sterile technique, it has to be at my waistline, and if I turn my back on my sterile field, it's no longer sterile. So I'm going to use the pinch and scoop method. So you're going to pinch with your non-dominant hand. You're going to put your dominant hand in first. So I'm pinching. Sterile glove on. Okay, this part that I'm holding here is going to touch my skin. So this part under here is not sterile. My hand is now sterile, and with this hand now I can scoop. So I'm scooping underneath that cuff. Would it be sterile if I did this to anchor it? No, I'd be breaking the sterility of that glove. So I am making sure that that glove is on my sterile field, that it's not like I'm pushing it out to here or any place where it's going to get contaminated. Putting my hand under that cuff because it's sterile under there. Hand goes inside. And I can fold it over. Taking my ring off. Okay, my hand is under here. This is sterile. Underneath, it's now touched my skin. It's no longer sterile. I can now kind of fix my glove on my hands. One thing that you don't want to do is then, don't worry about your wrists. Your wrists are not part of the procedure. Your hands need to be sterile. So if it's a little bit down from your wrist, it's not quite where you want it to be, don't worry about it. Just make sure that your hands are sterile. Okay, is this sterile over here? Yes, it is. So if you do need a little bit more sterile feel for something, you can actually use the inside of your packaging. Okay, so everybody is good with donning and doffing. So doffing, like regular gloves, one inside the other. Okay, dump them and then hand hygiene. Okay, questions about that? Okay. Okay, now I can move forward to my Foley catheterization. So I check the doctor's order, I check the chart, About a half an hour ago, I did a very thorough genitourinary assessment. I also did pericare, and I pre-medicated the patient. And not that this is a painful procedure, but it is uncomfortable, and sometimes patients will say it hurts. What they mean by it hurts, it's actually just uncomfortable. So pre-medicating the patient is also important. I've gathered my supplies. So I have here my Foley catheter tray. I looked at all the contents, which is what I need. It contains an 18 French Foley catheter, which is what they ordered. So everything that I need is here. The other thing that I'm going to take with me is a securement device. So I've got a couple of those. I'm gonna show you a couple of different options. And just for the purposes of lab, we do also have, this is called Mani Lube. It's mineral oil to lubricate the catheters, because we're not going to put lubricant inside the catheter, the mannequins. We're going to use this instead. So that's one time, I'm just gonna throw that on the bed, but it is going to be the one time where you're going to say that I'm not gonna break my sterile technique, but I do need to get some of this lubricant on my catheter for the test. Okay, so I've got on my equipment. Knock, knock, knock. Good afternoon, Ms. Jones. Yes, it's Michal again, and I'm now ready to insert your Foley catheter. Yes, we've talked about it before, and yes, you understand the purpose of why. Yes, I agree. You're going to feel so much more comfortable once your bladder doesn't feel full anymore. I'm just going to raise the bed to a good working height for me. Okay, I'm going to do my hand hygiene, and can you please tell me your name and date of birth? And I'm just going to take a look at your wristband here. Thank you very much. And I've got my equipment. The first thing that I'm going to do is I'm going to clean my surface. To dry, assuming that it's dry, and I'm going to get my patient ready. So I'm actually going to lift the blanket from the bottom, making sure that she's covered, that she's as comfortable as I can get her, and I'm going to position her legs the way I need them to be. So this is why an assistant comes in handy. You may need, oh, yeah. I don't know if I can take this off. Can you just put this over there behind you so you guys can visualize better? And this is where you may need to put a couple of pillows under the knees. This can be uncomfortable. This is where an assistant comes in. In fact, I'm going to recruit Bethany. See that? I remembered in the afternoon. Just take, when I tell you, you can help me spray. I'm just going to put these off to the side right now. Okay, so now I'm going to go ahead and I'm going to open up my some people like to use this as garbage. I can do that. Put it at the foot of my bed if my patient is not too squirmy. And now you'll see that the direction that this opens. So you want to open up your sterile field away from you. The first thing that you'll see here is that there's a drape, and it's even folded for you, so you know you can grab the one spot on your drape and you're going to open that. Are you going to? You're not going to do that. So you're going to open it, shiny side down, and I'm going to put it between my patient's legs. Okay, and I'm not going to touch it too much. This area here is sterile. The one thing that I didn't do that you want to say that you're going to do in your video is I really actually put a Chuck's pad or a towel underneath my patient first and then put that sterile drape down. Okay, now I'm going to continue to open up my sterile field. And quite honestly, this is the hardest part of the procedure right here. I like to put this kind of at the edge of my table. So then I'm gonna take my sterile gloves and I like to come to one end where I can open up my sterile gloves. Now, you need to be very careful here. Is that okay? No, it's not okay. So I wanna make sure that I'm within that 1 inch border. I'm going to pinch. I'm going to scoop. And what I'm doing is I'm actually anchoring it with my other hand, otherwise this is gonna move around a lot on me. Just scoop. Okay, and once I'm sterile, then I can adjust it and make sure that my hands are in properly. And I'm not gonna do anything else. That's it, my hands are now sterile. Now I can touch this, right? Is that okay? Is that okay?
Yeah.
That's okay. Is that okay? No, is that okay? Is that okay? It's not okay, right? So you just make sure that once your hands are sterile, you can touch all this. This in here is sterile, but the edges are not. What I do is I like to square this off, put the top and the bottom next to each other, and I have another drape here. This drape, I don't, it can be used, see if you like shiny side down, it would go like this, but I find it's more in my way than not for females. For males, it's a little bit better, so I just don't use this drape. So I put this off to the side. Now, a few things that you have here. Specimen container. This is the first time you're gonna get sterile urine. So if you need a specimen, this is a good time to get it, but urine specimen has not been ordered, so I can put this off to the side. 2 syringes. What do you think is in each of these syringes? Okay, so you're right, so to fill the balloon, is that what you mean? It's actually just sterile water, it's just sterile water, and the other one is lubricant. If you're gonna lubricate the tip of the catheter to get it in. But instead of the lubricant, because we can't put these on the mannequins, Bethany's gonna spray a little mineral oil on the tip of my catheter. Now, the other thing that it comes with is povidone iodine. And this is for your seconds. You've done peri-care, but you're also going to clean with povidone. We're not going to put povidone on the mannequins, and I'll show you. I'm going to open this, and you can see which end to open, because when I touch it, I can feel that this is soft, so that like a huge Q-tip. So the bottom, that's what's impregnated with the povidone, and the top is sticks. And povidone it's just really staining and sticky, so we don't want that on our mannequins. See, this is what they look like. Okay, so I'm just gonna leave them in here, but I'm going to put them in the side of my little box here. I'm also going to remove the sheath off my catheter. I'm going to be very careful as I'm taking it. You see how I'm kind of like collecting it in my hand? Because if not, it's just gonna go all over the place. It's gonna touch something. So make sure that you collect it, and I'm just putting it right back in. This I don't need. And I'm going to take my syringe, and it says on it, sterile water. Okay, so I know that's what I need for my syringe. And I'm not, of course, gonna pre-fill it, but I'm just going to attach it. Okay, my lubricant, what I like to do is I take my lubricant and I squeeze some lubricant in the corner of my box. That's how I do it. I know that some people have their povidone sticks, and they squeeze some of the lubricant onto this tray, and then they take both trays together. For me, I find that's too much. It's a very small space here, so I just do everything in one box. I'm now going to take it to the patient's bedside. Okay, so all of this sterile, right? And look how this povidone, it's very staining and sprays. Okay, I'm now going to come to my patient, and now I'm going to become half sterile. So I want my dominant hand to do all the work here. So my non-dominant hand is going to open up the labia. Once I touch the patient, I'm no longer sterile. So I really have to make sure that I've done everything that I need to do to prepare this equipment. before I become half sterile. Okay, so with my non-dominant hand, I'm going to open up the labia. I'm going to take the tip of the catheter. Bethany enters. Spray, spray, spray. Yeah, it's kind of just a little, little dab will do ya. Yeah, I know. Okay, I think some got on. I think that's good. That'll do. Okay, no, that's great. Okay, so I'm not gonna do that yet. It's lubricated, but the first thing that I need to do is swab. So I take one povidone swab down one side of the labia, garbage. Second povidone swab, other side swab, garbage. And then one down the middle, garbage. Now I'm ready to insert. Okay, so with my lubricated tip, I go into the urethra. Got it in the right place. What a rock star. Okay, and as soon as I see a flash of urine, then what am I gonna do? A couple of inches more, right? And it is quite a bit, it's almost to the bifurcation. Okay, I see the urine coming back. Now, at this point, I can just anchor this just a little bit because I really don't need to be sterile anymore. The catheter is now inside the bladder. I'm going to inflate my balloon. I'm going to keep my plunger pressed down as I untwist it off, and I can get rid of my plunger. Now it's nice and secure inside the bladder. If I needed to take a urine sample, if a lot of urine is quickly coming back, this is the only time, the absolute only time I'd be able to take a urine sample from here. After this time, no more, because urine that's sitting in a collection bag like that is just sitting there and it's growing bacteria. So you don't ever want to take urine from there. If in subsequent times I do need to take a urine sample, there's a port right over here. You would clean that port with alcohol, wait for it to dry. You may need to occlude the catheter like this just for a couple minutes, just for a little bit of urine to collect, and then with a syringe, you would come in and withdraw some urine. Okay, that's how you would take a sterile, that would be a sterile urine sample, but only the first time can you take it from here. Okay, now, this cannot touch the floor. It needs to be below the level of the bladder. Putting it on the bedside rail, not a good idea. This goes up, this comes down. This goes up, this comes down. This is not an appropriate place to put a catheter collection bag, although you'll see that. What you'll see at the side of the bed, and once you go to your own bed, you'll see that there's some metal bars, thin metal bars at the side of the bed. That is meant for these collection bags. So that's where I'm going to put my bag. And the other thing that I need to do now is I need to secure this somehow to the patient's thigh. Otherwise, when they're gonna get up and walk around, this is really gonna pull and be very uncomfortable. So there's a couple of options for securement devices, and on our cart back there, there's a whole box of these ones that tape on. And so what you will do, tape comes off, and the way that this works is you need to release. I'm gonna actually, this time, just take off these gloves so I'm not sticking to the securement device. You see that there's Velcro on the back sides of these. The way this works is the tubing of the catheter collection bag goes in the center of it, and then they kind of, one crosses into the other. And then it sits in it like that. That gets taped to the leg. Okay, and make sure that there's just enough slack, right? Patients move around, they get up, so you just want enough slack here. Okay, another option for a securement device. Another option is one that is non-adhesive, because some people really react to the tape. It's the same idea. Goes around the thigh. And you secure this in much the same way. Just like that. nice and secure, and just make sure that you leave enough slack. Okay, and then you can take all of your equipment. Where are you gonna get rid of all this stuff? Pardon me? Trash? Yep, trash, or look in your facility policy. They may want it in a biohazard bin. You want to reposition your patient comfortably. Oh, good, it didn't hurt. Yes, and you're already feeling better. That's fantastic. Here's your call bell. I'm going to lower the bed to the lowest position. Make sure my patient is secure and they have everything they need, and then I'm going to go document. I want to show you one other thing, which is how to discontinue the Foley catheter. I know that's not part of your skill, but good to know because you will be discontinuing Foley catheters. You're going to remove the securement device. You're also going to drain whatever urine is left in that collection bag before you remove the Foley catheter. You are going to get your A syringe, 10 milliliter syringe. It's good to opt on the side of a larger syringe than a smaller syringe. So 10 milliliter syringe is great. You're going to do your hand hygiene. You are in your blood and body fluids, so I do want gloves. I don't need sterile gloves, right? It's not a sterile procedure. I'm not inserting anything into the patient. I'm removing something. So just clean gloves. Get my syringe. And you'll see that initially this is deflating passively, but I do want to help it along. And what I do is I get rid of this fluid, but then I go back in a second time and deflate it some more, just in case there's anything left in there. I want to be 100% sure that I've removed all of that fluid, because that's going to be really uncomfortable for the patient if I pull out this catheter, if there's anything left in that balloon. Okay, take a deep breath in and deep breath out. Okay, excellent. That's all done. Okay, after I've removed that, either garbage or in the dirty utility room and like a biohazard bin is where you're going to dispose of that. Peri-care, there could be a few dribbles on the patient, maybe a little povidone left over from the initial insertion. You want to get that all clean, and then that's your discontinuation.